happy to take questions from any members of the press or media that may have them.
So, is your focus more in terms of FDA in investigation efforts or enforcement, or is it really both?
I think we're focused on enforcement. When you see the litany of, sure, we want them to continue to investigate. That's how come we know as much as we do about what goes wrong and what has gone wrong. And I think Dave's list of continuing violations, one after the other, says that the FDA really needs to get a lot tougher with the Red Cross. I really believe that if American consumers and patients knew the degree of violations, they would be extremely alarmed and very concerned about the well-being of their family members. So this is a real wake-up call to the FDA. This is, and I think we're all indebted to the AFL-CIO and the Workers Committee for Blood Safety and Red Cross workers, because they're really doing a public service bringing this to our attention. Consumer groups are going to be meeting with the heads of the FDA in the next couple of months, and I'll be sure to raise this issue with them and see if we can't get a much tougher response.
Since the Red Cross has received $2.2 billion from just the biomedical operations, have you asked why the money hasn't been invested in clearing up this problem?
Others might have a more comprehensive answer, but Arlene, do you want to address that?
Yes, we've certainly, in our discussions with the Red Cross, certainly at the collective bargaining table, we have talked about the importance of them investing these resources that they are collecting in training the staff, making sure that there is adequate staffing at every level at the blood drives. We've tried to make that argument as forcefully as we could. Unfortunately, it has seemed to have fallen on deaf ears, but certainly when you think about $2.2 billion, what disturbs us, and certainly what disturbs the workers, is it appears that we see profit being placed ahead of safety and trained workers, and that's very disturbing to us. Reinvest in the training of the workforce and reinvest in making sure that you have an adequate size of a trained and licensed workforce to ensure blood safety for donors and for recipients.
I got here late, so you probably covered this, but you mentioned staff reductions. To what do you attribute this? Is this, as you indicated just now, a drive for more profits, or what is the reason for
I think it's cost cutting, and it is a drive toward the profit. It makes absolutely no logical sense. We don't see a reduction in donors giving blood, but it is, if the management of Red Cross 10 years ago saw the need to have nearly 30 registered nurses who were on site with collection, but now they have reduced it down to 10, this only leads us to the conclusion that the decision is made as a cost-cutting effort, and that is, again, very disturbing to us. It is not putting safety first.
And when they reduced, say, from 30 to 10, did they replace the other 20 with different kinds of people as you were, I'm sorry, I'm just not
If
sure.
they
like nurses' aides or
as,
driver or whatever.
As what we've said, well, in some cases, and I can't say specifically in Connecticut, but we have certainly heard from workers that we've got the Bloodmobile driver now being licensed to be a phlebotomist and draw blood, and this is not something that he or she wants to do. That's not what they signed up to do. So you no longer have that licensed RN and is being replaced by other workers who, quite frankly, themselves tell us that they don't feel that they have the skills or the training to be able to handle the kind of emergencies that can arise when blood is being donated.